this time, everyone. Thank you for joining us, or else thank you for staying with us. Those who attended the keynote lecture just minutes ago. Very warm welcome to our two discussion. There's Sharifa Ezat and Piotr Karniej. Welcome, guys. It's a great pleasure to have you with us this morning. Well, the organizer gave us a very hard and tough question. And our job will be to discuss the policy frameworks for promoting public health. Well, tough thing, because public health by itself is a huge subject, and public health promotion is even bigger. And the frameworks, well, we'll set the frameworks as we wish. Actually, we have the mic now, and we are to decide. Well, let me make a short introduction. Well, like we looking at the survival, so the life expectancy, it's well, it's not proportional, but it's depending a little bit on the wellness of the society. The better we live in general, the more we spend on health, well, the longer we live. At least this is what the slide shows. But pay attention to that the curve is quite flat. If it was that the life expectancy would be totally income dependent, it would be at the 45-degree angle or close to that. Well, it's not, which means that it's something in behind. Well, it's not that we're not spending on health. Please look, these are data from today's morning. Today, well, the world spent already $6 billion. Today, not until today. Today, $6 billion have been spent for healthcare expenditures around the world. Well, that's huge. That's much more than was spent for education and military. Actually, it's more than it was spent collectively for these two purposes. But as I said, well, the angle is, well, it's kind of flat. Why? Because we have wars and plagues taking lives, and we have NCDs, as I said in the opening talk, that are taking prematurely taking lives. We have the 5 major groups of NCDs linked to 5 major lifestyle behaviors. These are behavioral risk factors, behavioral, which means absolutely avoidable. We just change the way we behave, the factors may disappear, well, 100% or at least partially. That's why spending on prevention is getting more and more popular. Why I'm afraid that when you look at the right-hand part of the slide, you see that the Poland in the group of OECD countries in 2020 was the only country with the decreased spending on prevention. I deeply believe that 2024 is much better from this point of view. Well, this I already showed, showing that every bad behavior has its price. So when we spend some money to prevent people from smoking cigarettes, we can make some extra money in the future. So we just may save on the expenses on the healthcare system in the future. When we prevent people from using excessive amount of salt, sugar, junk food, and so on, we can also earn some substantial money. So this is an investment. This is not a spending. We shall look at the money spent on improvement in the lifestyle, on the fight with the behavioral risk factors. We should look at them as an investment in the future. Well, this is true. When we look at the Polish data, you see that at the beginning of the 5th decade of life, so being 40 to 45, these are men in Poland, Polish male simply mostly die because of the alcoholic influence, which is the cirrhosis of the liver, number one, and alcohol use disorders, other, number three. Then when they survive the alcohol decade and they reach 50 years of age, and then we see that we have trachea, bronchus, lung cancer, and ischemic heart disease. So typically two groups of diseases that are cigarette dependent. So we see that the lifestyle or the behavioral risk factors, that's not only a story of a wolf in the old, but it's also a truth endangering of our health. And now we'll stop here because we're talking about the promotion of public health policy and the frames of that. So, Peter, well, let me start with you, because you, amongst other things you're doing, you're also active in education at several levels. And my deep understanding is that education is number one for any action in public health. Could you comment, taking your time?
Yes, of course. Thank you, Professor Fal, for the opportunity of being here. And if it would be possible, I would like to present some slides about it. Could you give me?
Sure.
Okay. Okay. So. For the first, what is necessary in our discussion, I think that, of course, let me. Okay. The most important discussion is that we have to look at the effectiveness of the everything we do in the education in the health policy. The most important problem is that the education, the health education, and the health promotion, especially in our country, but not only, is not very efficient because it doesn't have enough money. As you said before, the expenses for the health promotion, health prevention in Poland are very low, and unfortunately, I'm not so optimistic as you that in the next year it will grow very fast because of the other needs that our country has. So, in my opinion, the role of health promotion or health education, especially in the context of the harm reduction and the tobacco harm reduction, is really very important to us to talk about it. But unfortunately, our government and our political dissidents are not interested in this topic. And the very important thing is that our discussion all over the world about the importance of the health education, and health promotion, and of course the health policies in this context are divided into two. The first group of the scientists and discutants thinks that the harm reduction in the tobacco policies is important, and of course this is also, in my point of view, just like you, I think that it is really very important to us because this is kind of tool that we can use for our patients to help them in cessation of the tobacco smoking. But of course, we have an amount group of the patients who are not interested in this. And therefore, very important for the health politics and the dissidents is to talk that we have to take care about the other people who are not smoking and they are exposed for the smoke of the cigarettes. So this is really very important from our perspective. Unfortunately, in our politics all over the world, we are not using the compromise, some kind of discussion, because we are very often seeing a lot of governments, including the Polish government, is in the same situation when the discussion with the market is forbidden or not appropriate. So it is really very bad, because our governments are not fighting against the companies, but they have to fight against the situation, and this is really a very important issue. Of course, the importance of the public health policies, including the education that we said, is built into antagonize between the governments and the market, and this is very worrying to us, because well, this is the slide from the Guardian from today, when we are seeing that WHO says about that kind of antagonize. They say that a lot of governments are using, and of course not only the governments, but also the market, also the producers of the nicotine products are using misleading marketing and interfering the government's efforts to prevent killer diseases. This is not a very good language. I think that it's necessary to talk about the problem, not only the antagonize. And also, what is very important, but of course, we are not talking only about the nicotine products, but also the highly processed food and alcohol. And of course, it would be an absurd to think that the legal and systematic regulation can prevent it, because we know that it is not very efficient to do. I would like to present you kind of survey in Poland. It was done this year in March on the group of 500 Polish people aged 16 to 18. The first, what is very important to highlight is that in Poland, the sale of nicotine products to persons under the age of 18 is strictly prohibited. But however, these are purchased by teenagers via great markets, social media, instant messaging, websites selling illegal nicotine products, as well as through underage friends or older colleagues. So instead of the ban of selling those products to the young people, the problem is. And two organizers, the Moja company and the Fusion Labs, which is a company, the survey company, have done this report. And unfortunately, the 62% of adolescents who use nicotine products have already taken up nicotine for the first time between the ages of 12 and 15. Which is really very important. It's really very, very dangerous. And most of them has already had experience with traditional cigarettes before reaching for disposable e-cigarettes. This is the very important issue, because all over the world we are discussing about the problem of the nicotine alternatives as the first step of the initiation of the nicotine users. This report shows that it is not true. It shows that the people, very young people between 12 and 15 years, are starting from the cheapest solution of the nicotine, so normal cigarettes. So this is very, very important information for us. The most common reason for young people to use nicotine products is to relieve stress. And this is very important information. You were asking at the beginning, why do we use that kind of why do we have to use education or something like that? The answer is that it's very important to relieve stress. So this circumstance points us not only to the need for preventive measures in the context of nicotine use, but also in the context of psychiatry, coping with stress, relieving tension. Young people are not able to cope with everyday tension and stress. And this is really, really very important information to us also. I think that we have to know that more than half of those respondents will not give up e-cigarettes if they disappear from legal outlets. From this report, 49% of respondents will stop using them. This is very good information, but unfortunately, 20% of them will look for other products of this type, so the nicotine products, and 32% of them will look for other distribution channels. It is very important information because they will look the illegal sources. So this opens the way for illegal imports of nicotine products from abroad, including from countries such as China, for single-use products with unknown chemical composition and unstudied health effects. So this is really, really very important. And the last slide. From my perspective and from my point of view, the government actions all over the world, including the Polish one, must take into account the real, not the imagined circumstances of tobacco use, including the available through the illegal channels. If we are talking about health education and the health promotion in the context of the harm reduction, in the context of the tobacco use, we have to look out not only for the tobacco users, but also the problem of the psychiatry and the psychology. Because if we know right now that the first and the main problem of the tobacco use in the population of adults is a stress, is a problem of that kind of behavior. So we have to take care very strictly at this topic. We haven't talked about it, about the stress of young people and the stress relief of these people. Right now, we are seeing the connection between the problem of psychiatry and psychology and the context of the tobacco harm reduction. Unfortunately, the actions for international organizations and governments that antagonize the market for the sale and consumption are unacceptable. Okay, thank you. So this is the clue that our right now observable the political worldwide politics for the last 20 years have been ineffective, and therefore the health education, the health promotion is very important. Thank you very much, and I'm sorry for a long presentation.
Wow. What do I say? Sharifa, you're a professor, you're a lecturer at the university. You look at many aspects, you're active in many conferences, many places concerning the subject that we're discussing today. Peter told us, I think, about all the possible aspects. I kind of lost because I asked him about the education, primary education, but we went to other aspects. Please tell us, how do you think, when you observe the young people coming to the university, how important is the acceptance or lack of acceptance as a prevention tool? So is more accept official banning, or a lack of colleagues' acceptance, which plays a major role?
Thank you very much, Prof. Fal and Karniej. Can you hear me?
Yes.
Okay, yeah, all right, okay, thank you very much. I do have a presentation as well, but I don't think that I'm going to present it because of time, so we'll just talk here. You're absolutely right, Prof. Fal. I think coming from the public health perspective, there's a lot of problems in health promotion. Not saying that health promotion is priority is not high, but is that It's just that on tobacco harm reduction, this is not seen as something welcoming in many countries, including Malaysia. So we have problems trying to convince our policymakers, including students, that harm reduction also include tobacco harm reduction. They do not actually endorse it. Most of the society, most of the government societies, such as our National Cancer Society and things like that, do not look into harm reduction as an effective tool. They condemn us, and this hinders the public health promotion and also transferring of knowledge. So we produce papers. Of course, most of these are international papers produced by Profile. A lot of them are from Europe countries and also United Kingdom. Papers showing the DALIs, the life years that can be saved, the cost effectiveness by ICER and things like that, comparing between alternative nicotine products such as e-cigarettes, comparing this with NRT, comparing this with combustible cigarettes, but this is not convincing to some of our players. So we have two camps, as you mentioned. Most of the camps are in the so-called, perfectionist view, where the perfectionist view is that you don't have any tobacco, but you cannot also use nicotine. So in the end, what is left for the addicts, tobacco addicts to use? So they only propose NRT, which does not really work in the real world. At the moment, in Malaysia, we are example of a so-called upper middle income countries. Malaysia, near us is Singapore, Thailand, and Indonesia. Different background, but also different intensity of smokers. NRT does not really work well in Malaysia. We have a lot of failures. NRT can be purchased out of the over the counter. It's an OTC drugs, so they can use NRT from the pharmacies, but it doesn't really work. So this brings a lot of trouble when we tell our policymakers that you have to give priority, public health priority, to tobacco harm reduction, because we want smokers to switch. So that does not go very well. This is where we have a lot of convincing and also educating the public.
Okay. Thank you very much. This is, well, it's quite clearly clarified. This is really perfectly. Well, let me ask you another question, because, well, I know that Malaysia several years ago had a huge problem with the amount and percentage of smokers. And now you are doing quite fine, especially when compared to the neighboring countries, Indonesia,
Right.
well, when you oppose. So when you will tell us the story of the past years, a cigarette in Malaysia, will you tell us the story of success?
Yeah. The tobacco control in Malaysia is relatively quite good. The tobacco control policies, from the components of education, training, and others, the highest percentage or the amount of money is including for management, and this is typically, as what you mentioned, profile, COPD, cardiovascular events, stroke. So these are, in a way, most of the disease fighting. The second is actually enforcement. Enforcement actually takes a lot of our budget. So the enforcement is also quite strong. Unfortunately, there's also a bad part, meaning that we have a high percentage of illegal cigarettes in the region. The percentage is so high at the moment. 1 in 2 smokers, combustible cigarette, 1 in 2 are using illicit cigarettes. 1 in 2, and these cigarettes comes either from China. They also come from Indonesia, and also Myanmar. So these cigarettes are relatively very, very cheap. So it's just about 1/10 of the price of a legal cigarette. Having said that, we also see a differentiating trend where now the percentage of males smokers are getting lower. Most of this has transitioned into e-cigarettes, which is something that me personally, as a tobacco harm reductionist, I really am happy with this. But unfortunately, they are so innovative. There's a lot of sellers or vendors are selling e-cigarettes and mixing this with new psychoactive drugs like mushroom, cannabis, and that is something which is worrisome. So now we have double burden of not only people using cigarettes, but also using illicit vape. When they use illicit vape that is mixed with drugs, this causes the tobacco harm reduction a lot of being targeted. We are being targeted as promoting, mixing drugs with the vape. We keep telling them that actually the vape is just a mechanism. People use vape for a lot of things. People use vape to use it with vitamins. People use vape together with caffeine, and people also use vape in Malaysia with drugs. So this is not what we wanted. We keep telling people that vape is being used to reduce the harm of combustion in tobacco, not for people to experiment with drugs. Unfortunately, even though the enforcement is so-called strong, there are still leakages into the country where a lot of the illicit drugs are being sold together with vape, and they sell this to the lowest age of consumers, meaning that the school children are also using this. So this is it hampers our drive to promote public health, Prof.
Thank you. Thank you for this. This is it was extremely important what you said. And let me focus on this once again. The success, even though you have illicit import, even though you have other markets opening, including the cannabis market, but you had a policy of cooperating of at least 3 elements: education, primordial education at the kid level.
Yeah.
Second, good law and law enforcement. So it's not only law, but also law enforcement. Thirdly, to propose some substitutes. So you have harm reduction market developed. And having these 3 elements acting together, within 15 years, you cut the smokers by 60%. So this is a huge success, and I think that Malaysia should be always mentioned when we're talking of, well, this is not ultimate success yet. You have still a very long way to go.
A long way to go.
But what you did, it's really very good. And the final question to you, before I go back to Peter, the final question is, well, fine. The problem that arises or that's being discussed when we're talking about the harm reduction techniques or devices is that, well, there are maybe youngsters who will start using this group of products by using. Peter presented the data from Poland of the 17 old years that mostly they start with the cheapest cigarettes. Yes, but the second group, 38%, is those who start with e-cigarettes, and some of them now then are initialized and go into real smoking. So how do you prevent e-cigarettes to become such a problem that it can be even as much a health problem as cigarette smoking now? So how do you prevent youngsters from reaching out for this product that we say, well, it's like less harmful? The parents, well, let him vape. It's just a vape. It's not a smoke.
We have this problem, Prof. There are still youngsters who procure e-cigarettes or vape at a young age without any prior nicotine initiation, meaning they are nicotine naive, but they then take up vaping. There are a small group that does that. The other hand, we have a very strong education system where the education system basically deter the students from taking up e-cigarettes, meaning disciplining them, catching them in the act, and preventing them from bringing the vapes into the schools. However, we do realize that most of the students or the youngsters that use this, they use vape because they want to switch to a lesser harmful substance, meaning they want to switch to e-cigarettes because they used to smoke. Small percentage do take up nicotine, and this is what we want to deter. There is actually an age verification process if they go into legal stores. So legal stores will want to see their IC by right. So if they are 18 and above, then they can purchase the e-cigarettes. If they are less than that, by right, they cannot purchase the e-cigarettes.
How much
so they are already laws.
How much
enforcement again?
It's really
the
that
enforcement is.
It's really
no,
that
no,
I
would
have
say
no ID, I get no e-cigarette.
Yeah, I think
Is
it's
it
about
really
50%, Prof. Around 50%. 50% do
okay?
actually not go through it, but 50% would actually deter the youngsters from taking.
It's still good. Thank you once again. Peter, we're discussing all the time the point of view of a person who is smoking. So let me switch, let me start smoking or not, let me change my lifestyle or not. But we also have another option. We can look at it from the government level, and the government has many tools, including fiscal tools that can promote or dispromote behaviors, including cigarette smoking. And especially in the past 2 years in Poland, there is a huge discussion because we've been opening, closing, and reopening the excise tax code, and there is a huge discussion ongoing on how it should be taxated. Well, both alcohol and the cigarettes. What's the rule that, in your opinion, because you're an economist too, in your opinion, would be the most effective in the case of cigarettes quitting or cigarette habit decrease?
Well, yes, it's a very important issue because the problem of the taxation and the fiscal differentiation of the tobacco products are one of the main tool for the government to decide of the cost of this product. So, of course, it is very important to answer the question that if we are going to go to the situation when we are promoting the traditional cigarettes and we are saying, okay, they are very cheap and they have to be cheap. Or maybe we have to decide that the alternatives, the nicotine alternatives, are better, and then we would like to promote them to be the tool of the harm reduction. The problem is that our governments, especially the Polish one, have not decided about it. So we don't know the strategy. We don't know where are we going to, because this is a very important problem. The government very often doesn't want to talk to the companies, doesn't want to talk about the problem, and every discussion is understood as kind of lobbying. So, of course, the lobbying understood very bad and very
Especially
dramatic.
in this case.
Yeah, this is very true. So when we are asking about what route should we choose and what kind of the taxation policy should we have, this is not a very good answer, because the first question is, what future of the tobacco products are we trying to have? So, from my perspective, of course, the very important is to difference between the taxes for the traditional cigarettes and the alternatives, the nicotine alternatives, because of their influence of the society. So this is the first issue, and the second one is, of course, a very important policy of the banning the selling of the nicotine products to those who are not able to buy it, because as I said before, we have the problem that the people who are under the 18 years old are using the nicotine products, so instead of the legal requirements. So, I envy countries that recognize the role of education and the role of the health policy, including the Malaysia, for example, because this is a very important problem from the perspective of the government, from the perspective of the country. And last but not least is the income, tax income from the selling of the products. So we have to understand that the nicotine companies are very important companies in the global market and in our country market. So we have to look at them, we have to talk to them, and we have to try to understand their perspective, especially because they are changing too. So it's very important to understand that the society is changing, the world is changing, and we can't stay at the same position and the same situation for all years. So if you are asking about the economical perspective, very important is to understand whole market, not only the perspective of the government.
Thank you. Thank you for this. This is very important what you said, that the global attitude has changed in the past, and we cannot just get stuck in the policy that was probably active and effective 25 years ago. 25 years ago, Poland had one of the best anti-nicotine acting policies, and we had huge successes as a country, but the same regulations, the same ways, the same attitude that was effective and active at the beginning of the millennium is not effective or active anymore. And we finally have to understand and find a replacement, because otherwise we'll just turn the wrong direction. The last report published recently, a year ago, by the Polish Academy of Sciences says that the amount of or the percentage of daily smokers in Poland reaches 30%. It's much more than in the past 15 years. So we're not going the good direction. We're not following the good instances or the good paths. Now we are choosing the wrong ones, at least from the judging from the effects. Once again, I really very much want to stress the role of education. This is what Sharifa said about Indonesia and what you say, Peter, about Poland, but I want to stress the education at the lowest possible level. So I mean children, because educating those who already smoke or those who already drink, well, this is also important, but it's not as effective, and it's a little bit too late. So I would like to stress once again the very, very early health education, which will influence the entire attitude to our life, especially leaving aside for a while cigarettes or alcohol. We complain all over the world that women do not come to those tests for mammal diseases or cytology. Well, that the male after 40, they do not go to check with the urologist. Why? Because they are not health educated. They do not know why they should do that. So they see some announcement, go and see your urologist. Well, since I'm not well health educated, I don't know, why should I go there? So it's the same with understand, why should I not start smoking, or why should I quit smoking if I already do? So we need the education, the primordial education first, and then we will be more understanding. We as a society, as all the members of the society, we will become partners for a discussion, because I cannot discuss matters that I am not aware of. This is, well, the first regulation. So this is one thing. And final, I will come to you, Sharifa, for your final statement. If you were to advise your own government what to do in the coming 5 years, because of the medium-term policy, in the coming 5 years, to still decrease the amount of cigarette smokers in your country and to improve the health value at the same time, what would that be?
Yeah, I think three strategies, Prof. One is to reduce our NCD in general. Of course, NCD, there's a lot of cost risk factors. You mentioned correctly, sugar, salt, obesity, not active. But the main, number two is, the main thing is actually one of them is tobacco. So we must encourage the government to look at harm reduction as part of the strategy to reduce harm from tobacco. Meaning that either they switch, if they can switch by cold turkey or through NRT, yes, go ahead. But for those who are unable to quit and no intention to quit, they should actually use alternative nicotine products such as e-cigarettes or heated tobacco products or snus or nicotine pouches to quit smoking. This is very important. The third is that it has to go hand in hand with the economic aspect as well. So I would encourage our government actually to look at the tax that can be taken from excise tax from the e-cigarette as well, so they can actually use this to build up the healthcare system. But the tax needs to be proportionate. You cannot tax so high until the population goes back into cigarettes. Yeah, that's all, Prof.
Thank you. Peter, the same question goes to you, but I mean the Polish government this time.
Well, this is a very important question, because right now we have a lot of challenges to do in Poland, because of course our government has a lot of problems with the organization who are questioning the science at all, are questioning the problem of vaccination, for example, and the problem of the access to the patient and convince them to the good health habits is really very important, not only for the health professionals, but also for the government. So a very important problem is divided into the two. The first one is to convince the patient that the science is important and the science have some informations that they are worth to know, and to convince them that we know what is good. And the second is the same problem to convince the stakeholders, including the government. It is not very true that the government all the time is working at the same position as we are working, because very often they have our own problems, they have our own interests, and very often that interests are not going into the same direction. So if we would like to present some solutions to our government, is for the first to prepare a very good army of the health educators, because it is really very important. We are talking about the health education and the health promotion, but we don't have a lot of people to do this. So this is the first question. And the second is to convince the people that the health promotion, health education really is very important. I think it is a very important issue.
Thank you very much. Even though you are presenting attitudes for, well, different part of the world, well, actually the policy for fighting cigarette smoking looks kind of the same. Maybe the problems at this level are not exactly the same in both countries, because we are at different places of this path of fighting cigarette smoking, but still we more or less are following the same logics and the same policy. Well, hopefully the governments will also follow the same paths, the same pathways, and listen to what we had to say. I would like to add two things upon what have been said by yourselves. First of all, no matter what product we're talking about, are we talking the regular old cigarette? Are we talking the e-cigarette? Are we talking the innovative devices? Are we talking snus? Whatever. There must be higher penalties, and there must be more strength put into the prohibition of sales to the youngsters. Because otherwise, the theory, the concept of harm reducing is losing a lot, because at one side we reducing harm, at the other side we opening the door for some harm. This is one thing. Second, I think that even in the group of substances or techniques that are being called harm reducers, there are differences, and these differences have to be strengthened by both education and fiscal policy of the government. We have very technically advanced devices that will never become so cheap to be available in to every junior student, because this part of the market is very price sensitive. So I think that putting new regulations on excise tax and making in general all the products less available, but especially those harmful, absolutely no available, will be also one of the priorities that we mentioned. And at this point, I'd like to thank you guys both for this discussion, very fruitful in my opinion. I thank you everyone online, and have a wonderful afternoon. Thank you.
Thank you very much.
Thank you very much.